The United States ranks 49th out of 184 countries for maternal deaths and is one of 8 countries where rates are on the rise. Understanding the multiple and complex factors that contribute to the death of a mother requires consistent and collaborative efforts among all healthcare professionals. AWHONN and their members work to advocate for improving health both in and out of hospitals. In this report, they're urging Congress members to sign bills that will move towards decreasing maternal mortality, combat the opioid epidemic, and support paid family leave.
Every time I talk to a congressional staffer, the conversation always ends with, of course, my boss isn't going to do anything until he hears from one of his constituents. So This is like the Super Bowl for me. This is for my line of work, this is a big deal.
AWHONN members are descending upon our nation's capital today to advocate for bills that will ultimately improve the health of both mothers and newborns everywhere, truly showcasing how nurses are, in fact, partners in care, both in and out of their scrubs.
I'm asking the senators, representatives to just listen to us nurses at the bedside. We see these babies, we see what they need.
The Association of Women's Health, Obstetric and Neonatal Nurses, or AWHONN, has been the foremost nursing authority promoting the health of women and newborns since 1969. Today, 45 of its members are hitting the pavement for AWHONN on the Hill. These nurses turned lobbyists are seeking congressional support for bills targeting 3 of the most pressing issues facing mothers and newborns. AWHONN is advocating for paid leave for both mothers and fathers, a reduction in the maternal mortality rate, which is the worst in the developed world, and a bill to fight against the opioid crisis that's plaguing our nation.
You know, even though we have different specialties, and some of them are prenatal and some of us are intrapartum, and we can be that voice and we can advocate for those patients and for nursing, and that's why we're going to the Hill today.
We need to be much more interested in looking at what they're calling the 4th trimester and postpartum issues. We can't improve breastfeeding rates if you have to go straight back to work and don't have time to be with your baby. So, and we know breastfeeding is one of the things that just improves population health.
What are some of the challenges facing nurses in your region?
What I'm seeing in the Philadelphia, Bucks, Montgomery area, a lot of moms get sick. And the mortality and morbidity has been increasing in the United States instead of going down.
The United States is the only industrialized nation in the world that has a rising maternal mortality rate. If you're unfamiliar with that statistic, that's usually quite shocking, and people can't even believe that that could be true. And that's one of those things that really does catch somebody's attention.
And it's a particular problem for African American women. So we really need some help from the government to understand these issues and how we can combat this.
Also shocking is the opioid crisis that's ravishing families across our country.
What is happening is we're seeing people over and over.
It's definitely a problem in Lynchburg, and it's a problem in our state, and certainly a problem in the nation.
This bill, I think, is incredibly important because it will increase the number of healthcare providers, nurses specifically, to be able to treat women who have a substance use disorder. So hopefully, not only will she have a more positive outcome after the pregnancy, but certainly the baby as well, and they'll be on their way to recovery and rehab.
We're in the midst of an opioid crisis. We got to do something. This bill makes sense. It's got bipartisan support. It should pass. So I'm really hoping that what we did today makes a difference in moving these bills forward.
I probably would have never ventured to do this on my own without the support of this kind of group.
I really enjoy what AWHONN has done for me. It's really made me a safer, smarter, empowered nurse.
One of the outcomes that I'm hoping for from AWHONN on the Hill is that we will have 45 nurses who will go back to their own communities and continue to be advocates, that they will now be comfortable talking to an elected official or a policymaker about important legislation and about healthcare delivery.
AWHONN and its members are committed to advocating for change and improving health for all mothers and newborns. In Washington, D.C., I'm Danella Sealock Van Niel.